Namaskar. Once again, welcome to your channel that you come to for all the correct gyan and knowledge on health, wellness, and transformation, freedom from diabetes. I am Dr. Mayurika Das Biswas. On many occasions, you and I have connected to discuss about mental health, to discuss about meditation, mindfulness. Now, many times the problems faced by a lot of us can get a little severe, and people are confused that is this a psychiatric problem or is this a regular disturbance. क्या मुझे sadness है या मुझे depression है? Do I have some form of anxiety disorder, or I just tend to get a little anxious? So today we have with us a great expert. Now he's extremely humble, so he has asked me to keep his introduction very simple, but I will just say that it's been my great fortune that in my career I have got a chance to work with Dr. Nilesh Shah, who is the head of the department in Lokmanya Tilak Hospital, Sion Hospital in Mumbai. He has trained many stalwart psychiatrists across the country. So he's so humble and he's so nice. Between psychologists and psychiatrists, it's quite well known that he's quite a realized and actualized person. When you get to know him, you'll get to see that he's a very kind, genuine, and humble person. He's a great scholar, great researcher. Sir, thank you so much for giving us your precious time and coming over here on the MedX series.
With pleasure.
Sir, we want you to share your kind knowledge and help us understand that what are the common symptoms of depression that people face as they are growing a little older after their 40s.
Okay. So as it is usually said that 1 in 5 women and 1 in 10 men develop depression at least once in their lifetime. So if there are 10 people, 10 men watching this program or 5 women watching this program, one of them, one of the men and one of the women are likely to develop depression at least once in their lifetime. And there are two main common symptoms. One is what we call sadness of mood, pervasive sadness of mood. And second is loss of interest in day-to-day activities. So if you either have pervasive sadness of mood or loss of interest in day-to-day activities, then you must think that are you suffering from depression? Now, along with these symptoms, you will have other symptoms.
So pervasive sadness means like a constant state of sadness.
Yes, constant throughout the day. Not only that, even that quality of sadness is different than normal feeling of, when you feel a little upset and feeling sad. The quality is also a little different.
Because these days, a lot of people quickly self-diagnose themselves. I have depression. I'm depressed. You cannot put pressure on me because I'm depressed. How do you know you're depressed? I just know.
Yeah, so in that kind of situation, what we see is two things. One is intensity of reaction. Whether the intensity of reaction, that is feeling depressed, is proportionate to the precipitating event or it is disproportionate to the precipitating event. Like if there's a death in family and if you feel very, very depressed, obviously it is proportionate because you have lost very close ones. But suppose you lose your pen or if you fail in exam and you feel that there is no life ahead and you should end your life, this sadness is disproportionate to the precipitating event. So usually if somebody fails in exam, he will feel bad, he will feel upset, he will feel sad, but he will not think of ending his life. But if somebody starts thinking of ending his life, that means he's suffering from depression. So one, the intensity of reaction is much more than what is usually expected.
Hmm.
And second, the duration. So if you have a quarrel with someone, you will be upset for a day or two. If your friend doesn't talk to you or doesn't invite you for a party, you will be upset for 2-3 days. But if you remain upset for a month, then it is abnormally longer period. So it is disproportionate in duration. So if your feeling of sadness is disproportionate to precipitating event, either in intensity or in duration, then it warrants a diagnosis of a disorder called depression. And along with that, there will be impairment in psychological, social, and occupational functioning. So because you are so sad, because you are so depressed, that you will not be feeling happy, your social functioning will be affected. So you will not be meeting your friends, you will not be going out, you will not be involving in yourself in social functions, and your occupation will be affected. So whatever work you are doing will be affected. So you might not go to your work, or you make many mistakes on your work. Your attention concentration would not be optimum, kind of thing. Now, along with this, most of these patients with depression have sleep disturbances, either difficulty in falling asleep, waking up multiple times in the night, or very typical what is called as early morning insomnia.
Okay.
So person habitually is getting up at 7 o'clock in the morning, but now because he has developed depression, he wakes up at 4 o'clock in the morning, and then he doesn't know what to do. From 4 to 7, he just feels like lying down in the bed, doesn't feel like coming out of the bed, and he feels miserable. So that is early morning insomnia. Then sometimes there may be excessive sleep. So he might feel drowsy, lethargic the whole day. Similarly, there may be loss of appetite. He doesn't feel like eating anything. He doesn't relish. He doesn't enjoy food, which he used to do earlier, used to enjoy earlier. He may have mood changes. So he might become easily irritable, cranky. He might snap out at someone, and his attention concentration may get affected. So he might make frequent mistakes. And even for husband and wife, loss of libido. So indulging in sexual relationship may get affected. They don't enjoy, or they may not like enjoying that. So all these can be symptoms of depression. And at cognitive level, at mental level, at thinking level, hopelessness, helplessness, and worthlessness. So if you feel hopeless, that nothing can be done in this situation, helpless, that nobody can help you in this situation, and worthless, life is not worth living. So at cognitive level, at thinking level, if you have these thoughts, then also they are symptoms of depression.
So what if people experience some of these symptoms in isolation? Meaning, I do wake up early in the morning, but I'm having a good, healthy sexual relationship with my spouse, or just that I and my spouse are not able to have the same level of intimacy what we were having, but other areas of my life are going pretty well. What if there are symptoms in isolation? Does that mean that there is depression?
Yes, all the people do not develop all the symptoms. But the primary symptom is sadness of mood or loss of interest in day-to-day activities. Whatever you are enjoying every day, like somebody was enjoying reading books, somebody was enjoying music, somebody was enjoying going out and eating in the restaurants. So whatever you are enjoying in your day-to-day life, you are happy in your day-to-day life. Now you no longer enjoy your life, or you feel sad. If these two things are there, or at least one of these things are there, then yes, I would strongly suggest that it is very likely that you have depression.
Are there different types of depression?
Yes, manifestation may be different. One typically what we call retarded depression, slow depression. So person is very, very slow. He may wake up at 4 o'clock in the morning, but he doesn't know what to do. He has to make an effort to come out of the bed. Then everything is an effort. Brushing his teeth, taking his bath, it becomes an effort. He has to push himself. It doesn't come spontaneously, naturally. And the whole, he's just sitting down, not talking to anybody, not doing any activities. If he has to do some activity, it's very, very slow. So this is called as retarded depression. Speech output is very, very less. If you say,
Talks
what's
less.
your, yeah, talks less. And he may just answer in the minimum words. So if you say, how are you doing? Fine. Only that much. He will not say, oh, I am fine. How are you doing? You know, usual response is that. So that is called retarded depression. Anxious agitated depression is another type where the person, instead of retardation, is over anxious agitated. So he's all the time worried and anxious. What will happen next? What will happen next? Whether children will come back from school properly or not. It's already 4 o'clock. Why they have not come? My husband has gone to the work, but usually comes back by 6 o'clock. Why he has not come? Is it likely that they might have met with an accident? Suppose tomorrow there is a hartal, then what will happen? How we will go and catch the train? All kinds of negative thoughts. Whatever negative is possible, even if it's a positive event, like say going on a picnic. And if you have a agitated depression, you will, or anxious type of depression, you will start thinking, oh, whether I'll be able to catch the train in the time or not, whether there'll be good facilities. Suppose it starts raining, what we will do, whether we go to the resort and no food is available or no good food is available, what will happen? If our bus meets with a puncture on the road, we will be stranded. So see, they do not distinguish between probability and possibility. See, everything is possible. We are talking just now and there is a possible that there will be a big earthquake and all of us will die. It's possible.
Yes.
But what is the probability? 1 in million.
Yeah.
So we will not take it seriously. But when you are agitated, when you are anxious, when you are over anxious, each and every probability seems possible. This can happen, and you will feel equal weightage to remote possibilities. So that is agitated type of depression. Then another type of depression which we come across, what we call psychotic depression, where person develops false, unshakable belief. That is delusion. Delusion is a false, unshakable belief which is not shared by the other people in the house or the community. So it's not a superstition.
Could you give me an example? Could you give us an example?
Yeah, so we had this patient and he said, "Hum log bahut poor ho gaye. We have become very poor." So we said, "What happened?" He said, "We have kirana ka shop and we earn very well, but since last time we are very poor. So now I don't know what to do. I'm very poor, I'm very poor, I'm very poor." So we said, why don't you bring one of your relatives and we'll see what kind of help we can offer from our social work department. Next day, his brother came and he said, "Doctor, I don't know what has happened to him. We are very well to do, but I don't know what has made him think that we are very poor." See, usually our business is kirana ka business. So during festival season, we earn very well. We earn 50,000, 60,000. And when it's not a festival season, we earn little less, maybe 30,000. So every time from variation varies from 30,000 to 50,000 to 60,000. And again, we know that festive season, we will earn more. During vacation kind of season, when people go out, we will have less business. But I don't know what has happened to him this time. This time we had only 30,000 earning. So he started telling everyone that we have become very poor. So he doesn't allow us to cook food in the house. He says, we have become very poor. So you prepare only roti and dal in the morning and only rice and sabji in the evening. We can't afford 2 square meals per day. Switch off the fan, switch off the light. We cannot afford to pay the bill. And he says, these are all wrong ideas. So this is called delusion of poverty. We said, why this kind of situation has come in your life? He says, मैंने कुछ पाप किया होगा, गए जन्म का कुछ पाप है, बचपन में मैंने किसी को मारा होगा, किसी का नुकसान किया होगा. Have you done it? No, मैंने कुछ नहीं किया, पर शायद हो गया होगा. So delusion of sin. Delusion of guilt. मेरे से कुछ गलती हो गई है, मेरे से कुछ भूल हो गई है, मैंने किसी से ज्यादा पैसे लिए होंगे, मैंने गाय माता की पूजा बराबर नहीं की, मैं मंदिर में बराबर गया नहीं हूँ, इसलिए.
या मेरी सास ने मेरे पे जादू टोना किया होगा, इसीलिए मैं दुखी हूँ.
Now that has a paranoia in it. Here there is no paranoia. Here self-depreciating delusions. मेरे से कुछ गलती हो गई है, मैंने कुछ पाप किया है. So that is delusion of guilt. So delusion of guilt, delusion of poverty, delusion of sin, they are psychotic. And if you try to explain him, see, your brother is saying it's not true, your wife is saying it's not true, your shop is running well, I can see 100 customers going to your shop. Nothing will help him to understand that they are not poor. It's a fixed, unshakable idea in his mind. So this is called psychotic depression. And one more type, what we call kabhi khushi kabhi gam ki bimari. It's called bipolar depression.
Bipolar, yes. So many people also self-diagnose themselves as I'm bipolar. Sometimes I'm happy. I was happy in the morning. Now I'm upset in the evening. So I'm bipolar.
So these people, when they get episodes of depression, they get proper episode of depression lasting for 3 weeks, 6 weeks, 8 weeks.
Okay, it's not morning to afternoon.
No. It's at least minimum, the depression period has to be minimum 1 week.
Okay.
It can be 8 to 12 weeks or even longer. And the same person completely recovers when he's absolutely normal. And a third phase, so one depression, one normal, and another phase, what we call manic phase, where he becomes very high, exactly opposite of depression. So he starts singing and dancing and spending and waking up in the morning and exercising and distributing things to everyone and preaching everyone and calling everyone saying that how are you, and if you need any help, please let me know. I have lots of money and I know Modi ji ko bhi main janta hu, kind of thing.
This is very interesting, because I'd like to share with you, sir, that after joining the Freedom from Diabetes program, people first reverse their diabetes. Then they slowly go on to developing an athletic identity. They work on their mental and emotional and relationship issues. And one thing leads to another, and things start improvising, and they start feeling very good, very happy. Now, in this situation, how can their family members know that this is not some sort of mania, but this is just happiness? Because if you find them, a lot of people might look very manic to you because they're too happy. They're very excited about all the changes that have happened in their life.
As long as they are in touch with reality, then they are normal. The day you feel they are no longer in touch with reality. We had one tour operator who gave an advertisement in the newspaper during his manic phase that join this tour, Vaishnav Devi tour, Kashmir tour of 7 days, going and coming back by flight, Mumbai, Kashmir, Kashmir, Mumbai, Vaishnav Devi temple, darshan by helicopter ride, and 5-star hotel accommodation stay with sightseeing in Kashmir, 7 days tour for 20,000 rupees.
Oh, yes,
and
not in touch with reality.
Not in touch with reality. And people thought that this is a wonderful opportunity and such a gentleman he is. Some 100 people gave him 20,000 rupees and booked the tour. And he kept on booking the tour, taking 20,000 rupees from everyone. And then he sent that money to this 5-star hotels as a deposit money, 1-day deposit money kind of thing, and booked few tickets, etc. And then when the tour date was coming near, he went into depression. And then he couldn't do anything because he had no money and he didn't know how to work on it. And then he just sat, and people were wondering what has happened. He has taken money, and then they went to the police station and filed a complaint against him, and he was arrested. And then his wife came to us, and then she narrated the whole experience. And we said, oh, then we examined him and we found that he was really terribly depressed. And from his behavior, which he had done, we found that he was in manic phase at that time. And he had similar episodes in the past. So then we made a diagnosis of manic depressive disorder. We admitted him in the hospital. We gave a certificate to the police that he should not be held responsible for this kind of behavior because he was not proper frame of mind. And he and his wife said that they will repay the money in installment to all the people from whom they have taken the money. They signed a guarantee bond. And after we treated him, we told him that, see, you are getting these frequent episodes. You must take medicines regularly, and otherwise you will keep on getting these kind of episodes. And he completely recovered. After about 6 months, I was going near Dadar circle, and somebody called me from behind. Dr. Shah. And I saw, and the same gentleman was there. I said, oh, hi, how are you doing? He said, please come to my office. My office is nearby. I said, no, I'm a bit in a hurry. No, you must come. And he literally dragged me to his office and made me sit over there. He said, हमारे बड़े डॉक्टर साहब आए हैं, 2 सैंडविच लेके आओ, 2 जूस लेके आओ, समोसा लेके आओ. I said, no, I just had my lunch. I don't want to eat all this. नहीं, डॉक्टर साहब, खाना ही पड़ेगा. आइसक्रीम भी साथ में लाना. डॉक्टर साहब, आपके घर में कितने लोग हैं? मैंने बोला 5 लोग. 5 लोगों के लिए काश्मीर वैष्णव देवी टूर की मेरी तरफ से टूर बुक करो. मैंने बोला, साहब आप दवाई ले रहे हैं क्या? दे बंद कर दिया. नहीं डॉक्टर साहब, मुझे दवाई की क्या जरूरत है? मैंने पहले 2-3 महीने ली, फिर मैंने बंद कर दी. I immediately called his wife के अरे आपके हस्बैंड दवाई नहीं ले रहे. हाँ, he has again gone into mania.
Oh.
So this is also bipolar depression, where he had come to us in the depression. Yeah. So he had come to us in the depression when he was arrested by the police.
Yeah.
And then when he came out, he became absolutely normal. He started repaying. And then again, he went into mania and he was again going to repeat the same mistake. Right. Luckily, we could prevent it with his help of his wife.
Oh.
Because I met him, I kind of warned his wife, see, again, he's doing this, he's booking tours for everyone. He has already booked tours for me and free of charge.
There are so many interesting psychiatric case studies you come across. Please tell us from all your experience, how can families and caretakers and patients themselves manage depression better?
Yeah, so one thing, most of the time they try to justify their depression. So I am retired, that's why I'm feeling depressed. I got promotion, that's why I'm feeling depressed. My so-and-so did not answer, that's why I'm depressed. My distant friend passed away, so I'm feeling depressed. So one thing is, see, irrespective of the cause which you think in your mind, if you have developed a fracture, you will go to the doctor, orthopedic surgeon. You will not say कि मुझे फ्रैक्चर हो गया, उसने लाठी से मारा इसलिए फ्रैक्चर हो गया, कि मैं गिर गया इसलिए फ्रैक्चर हो गया, कि मेरा हाथ मशीन में अटक गया इसलिए फ्रैक्चर हो गया. फ्रैक्चर हो गया, irrespective of the cause. If you have developed the fracture, you should go to the orthopedic surgeon. So irrespective of the cause, what you think, which may not be true, but irrespective of the cause, you must go and meet a doctor and let doctor decide whether you have depression or you don't have depression. You narrate your symptoms and doctor will decide that yes, it's a depression or not. So first, do not hesitate to meet doctor. Psychiatrists are the doctors of depression.
Yes.
Unlike that, most of the people think psychiatrists are pagalon ke doctor. But schizophrenia, that is pagalpan, is 1 out of 100 people.
Right.
Depression is 1 out of 5 women and 1 out of 10 men, at least once in their lifetime. So
That is a
depression,
lot of prevalence.
so depression is much more common. Anxiety is much more common than schizophrenia. So
I think
instead
all
of,
of us know a friend who is having depression or will have it sometime in their lifetime.
so the way we have heart, we have lungs, we have our liver, kidney. Similarly, there is an organ called mind. So if your heart is affected, you will go to a cardiologist. If your kidneys are affected, you will go to a nephrologist. Similarly, if your mind is affected, mind is in pain.
Mm.
So if you have pain in abdomen, you will go to your doctor. Similarly, if you have pain in your mind, you must go to at least mental health professional. It can be a counselor, it can be a psychologist, it can be a psychiatrist, it can be a social worker, it can be a clergy. So at least go and share your feelings with someone and take help of a mental health professional whenever you have a pain in your mind, mental pain. It is a real pain.
Yes.
It is not imaginary. Let somebody say, "Ye natak karta hai." No, you are not doing natak. You are actually feeling that pain. So that is the least thing which you can do, that you can recognize that I am in pain and I must go and meet at least one of the mental health professionals whom I feel comfortable with. And then second, follow the advice.
Mm.
So he may advise counseling, he may advise psychotherapy, he may advise CBT, he may advise any other form of psychotherapy or medicines, depending on the severity of depression, depending on your inclination, depending on the symptoms. Please properly follow the treatment. And if you follow the treatment, you will feel much better. And also you can prevent the future episodes of similar illness.
Wonderful. That gives us such a lot of clarity. That gives us such a lot of clarity. So family members, friends, and people who are themselves suffering can take the suffering person to a mental health professional and follow the advice, try the advice that has been given. If I would say, if it doesn't work with one professional, do not give up on treatment, change your professional. Maybe go to another professional. If it does not work with one psychologist, maybe you take a good reference and go to a psychiatrist, or whatever may work. But it is always important to seek treatment.